everyone, my name is Francis Mercado from BSN2B. So today I'm going to demonstrate bag technique. What is bag technique? It is a tool used of public health bag through which nurse during his or her home visit can perform nursing procedure with ease and deftness, saving time and effort with the end in view of rendering effective nursing care. Render effective nursing care to the clients and or members of the family during home visit. So the principles are the use of the bag technique should minimize, if not totally prevent, the spread of infection from individuals to families, hence to the community. Bag technique should save time and effort on the part of the nurse in the performance of nursing procedures. Bag technique should not overshadow concern from the patient, rather should show the effectiveness of total care given in an individual or family. Bag technique can perform in a variety of ways depending upon agency policies, actual home situation, and etc. as long as principles of avoiding transfer of infection is carried out, and special consideration in the use of bag. The bag should contain all necessary articles, supplies, and equipment which may be used to answer emergency needs. The bag and its contents should be cleaned as often as possible, supplies replaced, and ready for use at any time. The bag and its contents should be well protected from contact with the article in the home of the patient. Consider the bag and its contents clean and sterile, while any article belonging to the patient as dirty and contaminated. So, the arrangement of the bag. The front of the bag, left to right, contains mouth thermometer, rectal thermometer, and on the right rear of the bag, here, containing the test tube holder and medicine dropper. And on the left rear end of the bag, the medicine glass, baby scale, bandage, scissor. And back of the bag, left to right, is alcohol, acetic acid, and aromatic spirit of ammonia, liquid soap in sterile water for cleaning thermometer. In the center of the bag, here at the center, kidney basin, soap in a soap dish, towel, apron, hypo tray with forceps, scissors, and needles. And others are the waste paper bag in a pocket of the bag, including forms. Principles for using bag technique: prevention of contamination, protection of the caregiver, make articles readily accessible, make follow-up care. Upon arriving our patient's home, we are going to look or find any suitable place where we are going to put a bag, most likely a flat surface or a table. Before we put our bag on a table, we are going to line it with plastic cover or Manila paper or any kind of big paper. So I have it inside my bag. Okay, the plastic cover. The clean side is up, and the folded part is the one who are going to touch the table. Okay. And we are going to line it with a Manila paper. Same as the plastic cover, the clean side is up, and the folded part is the one that will be touching the table. Okay. So I'm going to close my bag. And I'm going to put it on the edge of the table so that the other equipment or articles we are going to put it at this side. After placing my bag, we are going to ask the client if they have a sink and water for us to wash our hands, and if they don't, we are going to ask them if they have a basin and water. We're going to open my bag and get my hand towel, soap, and apron. So it will gonna wipe our hand, and the apron protects us from any cross-contamination from bodily fluid throughout the procedure. So this prepares us for hand washing. So I'm going to close it again. So after hand washing, I'm going to put an apron. The right side, the folded part is out, and the clean side face toward us. Um, this apron protects us we nurses, from any bodily fluid we may encounter throughout the procedure. Okay, so I'm gonna tie it. So after putting my apron, I'm gonna take out all the necessary equipments we are going to use in this procedure. Like for instance, I'm going to do a perineal cleaning, so we are going to use a cotton balls, irrigating solution, forceps and gloves, alcohol, and so on. So we're just going to take out all the necessary equipments that we are going to use for this procedure. And after that, we are going to close the stitch. Completing the nursing care or treatment, clean and alcoholize all the things used. So here, for this process is to avoid any cross-contamination. So we're going to use a cotton balls or any disinfectant solution to clean the used equipment. After doing hand washing, open the bag and we're going to put all back the used articles in their proper place. Okay, so we're gonna put this all in their proper places. After putting all back the used equipments, we are going to remove the apron. It should be folding away from the body. Okay, with the soil side folded away or folded inward, and the clean side is out. Okay, the clean side is out. And we're gonna put it back inside the bag. And so we're gonna close the bag. Now we're going to get the bag. So we're going to fold the linen. We're gonna fold it. Going to fold the linen. And we're gonna put it inside the bag. And now we're going to close the bag. Close it. After doing the procedure, putting back all the used articles and equipments, we're done putting back the apron and the linen. We're now going to discard all the used materials in the procedure and put it in a bin or a proper place where we should put this. And after that, home visit, make a post-visit conference on matters relevant to healthcare, taking anecdotal notes, preparatory to final reporting. And after that, we are going to make an appointment for the next visit. It's either home or in the clinic, taking note of the date, time, and the purpose.